Good morning everyone, I am Hanisha. Today I am going to present on study on macular and RNFL parameters in unilateral amblyopia. There is no financial disclosure. Coming to the introduction, amblyopia is unilateral or bilateral reduction in visual acuity induced by aberrant visual experience early in childhood during visual system development. It occurs in 2 to 4% of general population. The risk factors include strabismus, anisometropia, visual impairment, and high refractive errors. Usually, previously it is assumed that it is caused by functional and morphological changes in the visual cortex and lateral geniculate body. But recently it has been seen that amblyopia affects the postnatal retinal development, which may alter foveal thickness and RNFL thickness in amblyopic eyes. Our aim was to compare and access the average RNFL and macular layer in unilateral amblyopia with fellow eyes and age-matched controls using OCT. Coming to the materials and methodology, it is a case control study where the case group included 44 amblyopic patient eyes with their 44 non-amblyopic other eyes serving as internal controls, whereas 32 eyes of 32 age-matched subjects without amblyopia served as the external control. It was conducted in the tertiary hospital for a duration of 1 year. Complete ocular examination has been performed. The inclusion criteria included age more than 10 years, patients giving consent, unilateral strabismus or anisometropic amblyopia with no anatomical disorder, whereas the exclusion criteria included the history of glaucoma, any organic lesions or intraocular surgeries, bilateral amblyopia, deprivational amblyopia, any ocular pathology affecting the best collected visual acuity, and the patients or guardians who are not giving consent. Complete statistical analysis was performed. Coming to the results, this table shows the demographic profile of the study population. The number of the amblyopic eyes were 44, whereas the external control was 32. The mean age of amblyopic eyes was 20, and whereas the external control was 23. The male and female population in the amblyopic eyes was 20 and 22 respectively, and whereas in the external control group it is 14 and 18. Intraocular pressure was almost similar in both these groups. The best corrected visual acuity in the logMAR units in the amblyopic eyes was 0.51, whereas in the external control is 0. This table shows the distribution of the amblyopic patients. The anisometric amblyopia in our study was almost 90%, whereas the strabismic amblyopia, it was 9%. This graph shows the refraction distribution of the study group, where the myopic and hypermetropic patients were almost of equal percentage, and the astigmatism were little less. This is the table showing the comparison of sound and amblyopic eyes in different types of anisometropic amblyopia. In this, the different types of refraction, a myopic, hyperopic, and astigmatism, the refractive errors range was compared within the amblyopic eye to the sound eye, which shows the statistically significant difference. This is the table showing the comparison of macular parameters between amblyopic and sound eyes. In this, the central macular thickness and the each quadrant of the inner circle and the outer circle was compared between the amblyopic eyes and the internal control group, where the amblyopic eyes showed slightly thicker compared to the internal control group, but it is not statistically significant. This table shows the comparison of macular parameters between amblyopic and non-amblyopic eyes, where the amblyopic eyes showed slightly thicker in the central macular thickness and inner and outer quadrant compared to the external control, but it is not statistically significant. This table shows the comparison of RNFL thickness parameters between the amblyopic and the internal control eyes, where the average RNFL thickness and each quadrant has been taken in consideration, where the thickness is increased in the amblyopic eyes, but it is not statistically significant. This table shows the comparison of RNFL thickness parameters between amblyopic and non-amblyopic eyes, where the amblyopic eyes showed thickness, increased thickness, but it is not statistically significant. It is the relationship between the RNFL thickness parameters and spherical equivalent of the amblyopic eyes showed significant in the average nasal and superior and inferior quadrants. Coming to the discussion, in the current study, amblyopic eyes had slightly thicker macular and RNFL thickness parameters than fellow and non-amblyopic eyes, although this difference was not statistically significant. In these tables, the few studies were mentioned that are conducted in India, where they showed different results. Coming to the conclusion, we found no significant variations in RNFL thickness and macular parameters between unilateral amblyopia, mostly the cause being the functional. Thank you.
Just on time. Any questions? Yes. How do you define amblyopia, madam?
Sir, amblyopia is nothing but there is a
Yes.
amblyopia is nothing but the decrease in the best corrected visual acuity less than 6/12, just less than 6/12 with no ocular pathology.
Okay. So what are the types of amblyopia you have
Sir, I have
encountered?
mentioned about the anisometropic and strabismus amblyopia. Sir, we had anisometropic amblyopia, more number of cases we have got. Sir, strabismus we have got around only 4 to 5.
There are no other cases
No,
of
sir,
ametropic amblyopia
No,
or
sir, we haven't. In our inclusion
stimulation
criteria,
deprivation
we have.
amblyopia.
No, sir, there were very little number of those cases, so we have taken that as exclusion criteria. Sir.
Yeah. Thank you.